Okay, so today we're going to take a deep dive into something that's probably on a lot of people's minds, alcohol and how it affects menopause symptoms.
Mm.
We've got two pretty interesting sources to work with here.
Okay.
Um, one is a really thorough scientific overview
Right.
that looks at just generally how alcohol affects women going through
Oh,
menopause.
yeah.
And then we're going to kind of zero in on Gwyneth Paltrow's
Oh,
experiences
wow.
from a recent Goop podcast.
Cool.
She had Dr. Mary Claire Haver on,
I see.
and they were talking all about it. So that'll be kind of a cool personal angle
Interesting.
to look at it from.
Yeah.
And hopefully we can pull out some really useful nuggets to help you understand how alcohol might be impacting your own menopausal journey.
I think that's a great goal.
Yeah.
And I think a good place to start would be just to acknowledge that every woman's menopause experience is unique.
Oh, definitely.
The symptoms, their intensity, and how things like alcohol interact can be really different from one person to the next.
Mhm.
And there's still a lot we're learning about menopause.
Oh, yeah, for sure.
It's a constant area of research.
Absolutely. So let's jump right into that first source.
Okay.
Alcohol's effects on menopause. A comprehensive overview.
Sounds comprehensive.
It is. It's really thorough.
Yeah.
So one of the first things it digs into is these hormonal fluctuations
Right.
and how alcohol might be playing a role in those.
That's interesting.
Yeah. So what stood out to you there?
I thought it was really interesting how they talked about estrogen.
Okay.
Because, we know that estrogen declining is like a hallmark of menopause.
Right.
But what this overview says is that alcohol can sometimes cause a temporary increase
Right.
in estrogen levels.
Oh.
So it's not just about the overall decline.
Right.
It's that there can be these sudden spikes and then dips,
Oh, wow.
which can really throw things off.
So it's more about the balance being disrupted
Yeah,
than
exactly.
just the levels going down.
Exactly. And the overview suggests that this kind of imbalance could actually be contributing to hot flashes and mate sweats.
Oh, that makes sense.
Right, because it's not just about one hormone, it's about the whole system.
The whole delicate dance.
Yes.
Yeah. And speaking of messing with those hormone levels, this could also affect people who are using HRT,
Oh, absolutely.
hormone replacement therapy.
Right, because you're intentionally trying to manage your hormone levels.
Mm-hmm.
And alcohol can actually interfere with how well that works.
Yeah. How so?
Well, it has to do with the liver.
Okay.
The liver plays a really key role in processing those supplemental hormones that you're getting with HRT.
Right.
And alcohol can really put a strain on the liver.
Oh, so it can't do its job as well.
Yeah, potentially.
Mm-hmm.
So if you're on HRT,
Yeah.
this is definitely something to talk to your doctor about.
Really important to get that personalized advice.
Definitely.
Okay, so let's talk about one of the most common and annoying symptoms.
Yes.
Hot flashes and night sweats.
Oh, the dreaded hot flashes.
Yeah, and this overview is really clear that alcohol is a known trigger for these.
Yeah, for a lot of women going through menopause.
So what's going on there physiologically?
Well, it comes down to how alcohol affects our blood vessels.
Okay.
It's a vasodilator, which means it makes them widen.
Oh, so more blood flow.
Right, and that can lead to an increase in body temperature.
Uh-huh.
So basically that relaxing glass of wine
Yeah.
could be setting you up for a really uncomfortable night
Oh, gosh.
with those hot flashes.
Definitely something to think about.
Ah.
And speaking of uncomfortable nights, let's talk about sleep.
Oh, yes, sleep.
This overview also talks about alcohol and sleep disruptions.
Yeah, because that initial drink might make you feel sleepy.
Right, a little drowsy.
But alcohol actually messes with your sleep cycles.
Oh, so it's not real restful sleep?
No, it can lead to what's called fragmented sleep
Okay,
and poor sleep quality later in the night.
makes sense.
And of course, menopause can already make it hard to sleep.
Oh, yeah, with the night sweats and everything.
Exactly. So adding alcohol on top of that
Okay.
can just make things way worse.
The insomnia just piles on.
Absolutely.
Okay, the overview then goes into mood and mental health,
Yeah,
which we know are hugely impacted during menopause.
definitely a lot going on there.
Yeah. So what did you find interesting in this section?
I think it's important to note that the connections here are really complex.
Right, it's not always a simple answer.
No, but the overview suggests that alcohol can worsen existing mood swings,
Oh, that makes sense.
irritability, anxiety, things that some women are already dealing with because of hormone changes.
Right, so it's like adding fuel to the fire.
Yeah. And even more concerning is that it also talks about a potential link with depression
Oh, wow.
for some people.
So while a drink might make you feel better in the moment,
Right.
it could be having a more lasting negative effect.
Yeah. And it's not just about the alcohol itself.
Right.
It's also about the sleep disruption and the stress it puts on your body. It's all connected.
Exactly.
Okay, so moving on to something that's maybe not on everyone's mind, but is so important long-term.
What's that?
Bone health.
Oh, yes, of course.
And the overview has a pretty clear warning here.
Yeah, what's that?
It says long-term alcohol use can really negatively impact bone density. And we know that menopause already causes bone loss.
Right, because of the estrogen.
Exactly. So adding alcohol to that mix
Yeah.
can significantly increase your risk of osteoporosis.
And fractures.
Yeah, especially later in life.
Scary to think about.
Yeah, especially as we get older.
Yeah, and the overview explains that alcohol can interfere with the cells that actually build and maintain bone tissue.
Wow, so it's directly affecting that process. Okay, another big concern for a lot of women during menopause is weight gain.
Right.
And the overview touches on that as well.
Yeah, what does it say?
Well, first of all, alcohol is pretty calorie dense.
It is.
So those calories definitely contribute to weight gain.
And our metabolism slows down during menopause.
So it's kind of a double whammy.
It is.
In terms of weight gain.
The overview also mentions that weight gain, especially around the abdomen,
Oh, yeah.
is linked to a higher risk of heart disease.
So
So that's something else to keep in mind.
definitely.
Okay. And thinking even more broadly about those long-term health risks,
Yeah.
the overview points out that excessive alcohol use during menopause
Right.
isn't just about those immediate symptoms.
Right. It's not just about the hot flashes.
Exactly.
Yeah.
It could also increase your risk of developing more serious chronic conditions.
Like what?
They mention liver disease, cardiovascular problems,
Makes sense.
and even breast cancer.
Wow, that's serious.
It is, and they think this is because of how alcohol affects hormones,
Right.
inflammation, and just the body's overall metabolism.
It's impacting so many things.
It really is. And finally, they touch on blood pressure,
Oh, yeah.
how alcohol can cause those temporary spikes in blood pressure.
Right.
And since women are already at higher risk of hypertension during and after menopause,
That's something to be aware of.
yeah, because it could make that problem worse.
Definitely. So that was a really, really in-depth look at how alcohol can interact with menopause.
It was.
And I think the main takeaway is that while an occasional drink might be okay for some people,
Yeah.
regularly drinking too much could really make those symptoms worse
It seems like it.
and increase the risk of longer-term health issues.
Right. You got to be careful.
You do. And I like how the overview ends by saying it's important for each person to pay attention to how alcohol affects them
Yeah.
and talk to their doctor to get advice that's tailored to them.
I think that's really important.
Yeah, it's not one size fits all.
Definitely not.
Okay, so now let's shift gears a little bit
Okay.
and look at this second source, which gives us that really interesting personal perspective.
Sounds good.
This is the article about Gwyneth Paltrow
Right?
and how alcohol affects her menopause symptoms.
I'm curious about this.
Yeah, it's really fascinating to see how these broader scientific things...
Actually play out in someone's real life?
Right.
So according to this article, Gwyneth Paltrow, who's 52,
Okay.
noticed that when she drank more alcohol, her menopause symptoms got worse.
Interesting.
Yeah, and it seemed like she had things pretty well managed before this.
Yeah, it says her symptoms were pretty well under control
Right.
until January.
Okay.
Now, the article doesn't say what year this was.
Right.
But based on some other things mentioned,
Oh, yeah.
like the Saint Laurent Fashion Week,
Yeah.
it was probably early 2024 or 2025.
Yeah, that sounds right.
So during this time, there were those big wildfires in LA.
Oh, yeah.
And she said she was drinking every night for 2 weeks.
Wow.
She even joked that it was like she was medicating.
Well, I mean, that's a big change
It is.
for someone who usually only has like one drink a week.
Yeah, pretty significant increase.
Yeah. So what happened when she started drinking more?
Well, she said her symptoms went completely out of control.
Oh, wow.
And she even said it was the first time she really saw that direct link
Between the alcohol.
between the alcohol and how she was feeling.
So what were the main symptoms she was struggling with?
The article says it was mainly sleep problems
Okay.
and really bad hot flashes.
Oh, gosh.
Yeah, she described them as horrible.
That's rough.
And it's interesting because Dr. Haver, who is on the podcast with her, said that a lot of her patients have noticed the same thing,
Really?
that cutting back on alcohol
Yeah.
really helps with sleep and hot flashes.
Wow. So that's like anecdotal evidence
It is.
supporting what that overview said
Yeah, it really lines up.
about alcohol being a potential trigger.
Exactly.
So it's pretty compelling.
Yeah, even though, like, Dr. Haver said,
Yeah,
we still need more research,
right.
specifically on the link between alcohol and hot flashes.
It's still early days.
It is,
Right.
but these personal stories and observations
Yeah.
are definitely giving us some clues.
Definitely. Now, the article also mentioned some other challenges Paltrow was having,
Okay.
even before she started drinking more.
Like,
Well, back in 2023, she said she was really in the thick of perimenopause.
oh, so that's the lead up to menopause.
Yeah, and she talked about having insomnia and anxiety,
Oh, wow.
including those really intense late-night thoughts.
Yeah, that feeling of just lying awake, worrying about everything.
Mm. I know exactly what you mean.
It's awful.
It is, and it's so common
Yeah, a lot of women experience that.
during this whole hormonal shift.
Mhm.
And Dr. Haver had some interesting thoughts on why some women have more intense symptoms.
What did she say?
She said that women who have what she called more unhealthy habits
Okay.
tend to have worse menopause symptoms.
And what does that mean?
She defined that as drinking alcohol regularly,
Okay.
eating a lot of processed foods,
Right.
and not exercising enough.
Makes sense.
Yeah. But she also made this really important point
What's that?
that even women who are super healthy can still have bad symptoms.
Oh, that's good to know.
It is.
Because it's not all about our choices.
Right. Sometimes it's just biology.
Yeah, the hormones are powerful.
They really are. The article also briefly mentioned hormone therapy.
Okay.
Paltrow said she was either using it or thinking about using it.
Interesting.
And she was surprised that her mom went through menopause without it,
Huh.
which I thought was interesting.
Yeah, it shows how things are changing
They are.
in terms of how we think about and treat menopause.
Yeah, definitely. So if we put together the timeline here,
Yeah.
we see Paltrow going through perimenopause before 2023.
Okay.
Then she's in the thick of it
Mm.
in 2023.
Mm-hmm.
Then she starts drinking more in January, probably 2024, 2025,
Right.
and her symptoms get much worse.
Yeah.
And that leads to this recent podcast conversation.
It all connects.
It does. And I think the main takeaway here is that both the science
Yeah.
and this personal experience
Mm-hmm.
point to alcohol potentially having a negative impact on menopause symptoms,
It does seem that way.
especially hot flashes, sleep problems, and mood swings.
Those are some of the big ones.
They are, but we also have to remember
Yeah.
that everyone is different.
Right. What works for one person might not work for another.
Exactly. And there's still so much we don't know
That's true.
about this whole connection between alcohol and menopause.
Yeah, more research is always needed.
Always. So I think this brings us back to that idea of being really self-aware
Absolutely.
during menopause.
It's so important.
It is. We've seen how research shows these potential negative effects of alcohol.
Yeah, on things like hot flashes, sleep, and mood.
And then we have Gwyneth Paltrow's story.
Which seems to back that up.
It does. So what advice would you give our listeners?
I think the most important thing is to really pay attention to your body.
Yeah.
Notice how you feel in relation to alcohol.
I keep track.
Yeah, keep track. Do your hot flashes get worse after a drink?
Mm-hmm.
Is your sleep disrupted?
Right.
It's about noticing those patterns.
Absolutely. Because while these personal anecdotes in the research give some clues,
Yeah, they provide a framework.
your own experience is really the most important data.
It is.
And it's about being curious and almost like an investigator.
Yeah, trying to figure out what works for you.
Yeah, and I think it's also important to remember
Mm.
that while Gwyneth Paltrow's experience is interesting,
Yeah, and it might resonate with a lot of people.
right,
It doesn't necessarily represent everyone.
and the science is always evolving.
Yeah, we're always learning new things.
So what's a good next step for our listeners who are intrigued by all this?
Well, if you're noticing a consistent pattern
Yeah.
between alcohol and your menopause symptoms,
Mm-hmm.
I think it's a great idea to talk to your doctor.
Yeah, get that personalized advice.
Exactly. They
Uh-huh.
can look at your health history and help you make informed decisions.
Such good advice. So as you navigate your own menopause journey,
Yeah.
be mindful of how things like alcohol might be affecting you.
And I'll leave you with this thought.
Okay.
We've talked about alcohol,
Yeah.
but what other everyday habits
Yeah.
might be subtly shaping your menopause experience
Mm-hmm.
in ways you haven't even considered?
That's a great question to think about.
It is food, exercise, stress. There are so many factors.
And how they all interact.
It's a fascinating journey.
It is.
So pay attention and see what works best for you.
Great advice. Thanks for joining me for this deep dive.
It was my pleasure.
And to our listeners, thanks for tuning in.
Yeah, thanks for listening.
Until next time, take care.
Bye.